Welcome to this webinar, I want to introduce myself and the expert first. So my name is Melanie Goisov. I'm Senior Scientist in the BBMRI ERIC ELSI team, and I will be moderating this ELSI dialogue. And today we are going to explore patient engagement in oncology research. Briefly, some background about BBMRI ERIC. BBMRI ERIC stands for Biobanking and Biomolecular Resources Research Infrastructure European Research Infrastructure Consortium. And it has the scope to facilitate access to sample and data collections across Europe to advance biomedical research for the benefit of the European citizens. To reach this goal, BBMRI ERIC relies on a network of national nodes in the member countries, as well as a team of interdisciplinary experts from medicine, social science, ethics, law, IT, quality management, patient community, and industry partners with shared values of facilitated access to progress in healthcare and disease prevention. And in 2013, BBMRI ERIC was set up as a distributed research infrastructure and is one of the largest research infrastructures for health research in Europe. As regards ELSI services and research, we provide support on ethical, legal, and societal issues, and we operate on the basis of a federated model in partnership with a network of experts from academia and practice from across both our national nodes and project partners, alongside three cornerstones, which is research, service, and training. And I also want to let you know that this webinar is possible thanks to the funding from the European Union's Horizon Europe Research and Innovation Program. And specifically, it is supported by the canSERV project that focuses on providing cutting-edge cancer research services across Europe. And the aim is to offer a comprehensive portfolio of oncology-related research services available to all scientists in EU member countries, associated countries, and beyond. And if you want to learn more about the project, visit canserv.eu for more information. And I also want to welcome and introduce today's experts. First, Margareta Haag. She is the chair of the Swedish Network Against Cancer, an umbrella organization for cancer-profiled patient organizations and their families. She is founder of the Swedish Association of Chronic Edema in 1999 and president 2010 to 2024. And she is now a senior advisor. And she's also actively involved in advisory council, national innovation programs, and European patient advocacy initiatives. Stephanie Howard has a really strong background in science, specifically in biology, in public health, and in pharmaceutical chemistry. And she has been actively engaged in patient representation. And since 2012, she's an active member of the patient community and patient representative in science and politics, specifically the BRCA network, an association founded in 2010 to represent those affected by cancer. And she's co-founder and managing director of Partivo, Advancing Participatory Skills, proceed support and evaluation in health. And last but not least, Zisis Koslakidis. He's a virologist and head of laboratory science services and biobanking at the International Agency for Research on Cancer and the World Health Organization. And he's responsible for one of the largest and most varied international collections of clinical samples in the world, focusing on gene-environment interaction and disease-based collection. And he has a significant expertise in the field of biobanking and has also served as the president of ISPER. So welcome everyone, and thank you for your time and expertise to this important topic. Just a final point for the audience. If you have any questions, please put them in the chat and we will answer them at the end of our talk. First of all, going back to our topic of today's webinar, patient engagement. And as you may know, there are many terminologies out there: involvement, engagement, participation, collaboration, consultation, and so on and so forth. So let me briefly give you a bit an overview, so then we can also build on that in our discussion. And many thanks also to Stephanie to provide us with this slide, and based on an article she authored, and where she also outlines how patient representatives contribute to health research and care by offering valuable knowledge that complements scientific and clinical expertise, and also how to present the broader patient community in order to contribute to more inclusive, effective, and ethically grounded research and healthcare. And in her article and the example you can also see here, she outlines the different levels, not ranking in that sense, at which patients can be involved in research, and also illustrates how roles, responsibilities, and influence can vary depending on the degree of participation. So we move from the lowest level, so to say, compliance, where patients are simply enrolled in studies and follows instructions. This is not, in that sense, considered, well, real participation, and as it also lacks a bit of influence and decision-making power. The next level would be consultation, where patients might be asked for their opinions, for example, in focus groups or user testing of questionnaires, and their input may influence decisions, but only if it's actively considered. So further up is cooperation and co-learning, where patients are actively involved in research processes such as co-developing study materials, helping optimize questionnaires, or participating in implementation. And here they share decision-making power and bring in a broader patient community perspective. And so to say, the highest level, co-learning, patients act as full partners in planning, often sitting on boards and committees, and they represent not just their own experiences, but the collective insight of the patient community, also using a systematic perspective to also guide decisions. And overall, this helps us differentiate between more passive involvement and empowered participation, where patients help shape research from start to finish. So, as I said, and that's also pointed out in your article, this is not simply a ranking in that sense, but it outlines really the kind of the levels of participation, which is of course also context dependent. So it doesn't mean, as I understand your article also correctly, that it is always kind of also necessary to aim for the highest level, but other things can also work if it fits the project. So taking an overview now about this and the various ways how patient can be, I would say, included, engaged, or involved. And maybe, Stephanie, first the answer to you, since I already presented your work, if you want to add anything to that. And also then, based on that, on various different ways of or modes of engagement, what would then, and this of course also then to the other questions, but I start with you, I would say, how would successful patient engagement then look like in oncology research from your perspective?
Mm-hmm. Yeah, thank you very much, and a very warm welcome also from me on this afternoon. Very excited and glad glad to be here. So to add, I just want to strengthen what you said. So those are levels, and patient engagement, involvement, participation is rather a process, and it has to come with an attitude then that it's a strict form. So with these levels, all of them are equally important. And this is what this table wants to show, that within one project, you can have different or reach different levels of engagement with different people then. So there will be other people, or some people will be a project partner in this instant, or in this example, to develop a questionnaire. Others then will test it within focus groups, and then again, other people will fill it out. So you have really lots of people, just like in science, or just like for other groups, they are collaboration partners, and they're very heterogeneous. And what I think what is a successful patient engagement in cancer research, or general in research in general, is that it has to come, I think, really with the attitude. And the attitude, I have to say, can be trained. Because as you said, I'm a scientist myself, and I was never trained to work with other people outside of science. So we have this a lot now with citizen science and patient or whatever group engagement we have. And I myself never learned that. And also in science, I think what we learn is that we take several forms of knowledge as knowledge or true knowledge, and then to learn and get the attitude that these experiential knowledge that we as groups have when we are stemming from certain patient communities or from certain other groups, that this group knowledge and what we call accumulated experiential knowledge is very extremely valuable and adds to the academic knowledge. And I think this is very important, and this is for me the basis to acknowledge this for successful patient engagement. And then, as patient engagement is so extremely heterogeneous and really depends from project to project, depends from context to context, even in politics and wherever, that I think it's important for these different stakeholders or people who should work together to reflect and think together what in this very project would mean successful engagement for them, then to not necessarily have a certain contract, but really talk about this and really set the base for this, and then reflect this on and on. So there is no recipe, or from my point of opinion, no certain recipe, or not really a checklist for successful patient engagement, but you really have to discuss this. But I'm really also curious what our other colleagues are thinking about this.
Thank you so much. Then I would right away hand over to you, Margareta. So, successful engagement, how would you describe it?
Well, thank you, Stephanie, for giving your speech now, because it was really worthwhile. And thank you, Melanie, for having me in this webinar. But as a patient, you really come in very non-literate in anything. You just go to the doctor and you really would like to know what's happened to me. And it takes time to become sort of a patient that actually can communicate with persons on the other side of the table, I would say. And then also in research. In Sweden, we would ask patients who would like to be advocates to go through some kind of training. And there is, within the cancer care, they have actually set up a training for patient representatives and patient advocates. So you can learn about the system in the hospital, but also in the system in the region and in the country. And that is a very good start, but it's a start. And when we have patient councils in research, then we actually have asked them to fulfill the Swedish EOPATHY training. so that they are more knowledgeable about pharma, about the cancer care, oncology, and so forth, and research. But we also ask the researchers to train so that they know anything about the patients and the patient perspective. And that has been, I think, a bit complicated for a while, but we are now into terms with this. And it becomes successful because we understand each other. The patients understand the researchers and the process of research, because that is really difficult for a patient to know the whole process, and for the researchers to understand the patient partners in research. And then you can actually achieve some kind of successful meaning and successful research, because then it also becomes a relevant research if the patients are there. So it takes time for a patient, but it also takes time for a researcher, and especially if it's a molecular, somebody doing research in molecules and say, well, why should I meet the patient? I see the cells. And we say, well, behind the cell, there is a patient, so you should actually know them. But that would be successful for me.
Mm-hmm. So you draw the bigger picture, right? Of it's cancer and it's cancer care. So it's embedded in a wider context, in a wider system. You also mentioned before in Sweden, you have the notion of primary and secondary engagement. Would you like to add something to all the definitions we already mentioned so far?
Yeah, we have actually done a report on better research and better healthcare for patients and for the system in Sweden. And when we made all these definitions in Swedish, it was around 20 definitions, and very complicated to understand which is what, and what is what. So only 1 week or 2 weeks ago, one of my colleagues in research, she said, well, why hadn't I thought about this? We should start saying primary engagement and secondary engagement, because primary would be when you sit with what you describe as compliance, I would say. That is the primary engagement. And then working up the levels, you would be a secondary engagement when you come to the systems. And I think that will be easier, both for researchers to understand and for patients. Because for patients, it's very difficult if you put the levels, if you just say engagement and then you say co-creation or collaboration. So what is what? So I think that the secondary engagement would actually describe what it is. And it's the first, and we compare it then with primary care and secondary care.
Mm-hmm. But I mean, I understand it correctly. So primary engagement is then already kind of designed as having a place there, right? In also in the primary care.
Not necessarily. You will walk on the step. You will be on the steps to see what you can find. That would be the primary, and then after that you become, when you're more knowledgeable, and when actually you can sit and co-create and collaborate with professors or with politicians and so forth.
Mm-hmm. All right, thank you very much. So also for a bit perspective on Sweden, I want to hand over to Cisis. Also successful engagement. How would you describe it from your perspective?
Well, starting to breaking down some of the silos that have existed for a long time. So one of the issues that we have is that a lot of the systems that we see globally as part of our work have not been designed with patient engagement in mind at all. And in fact, even when there are some initiatives to address this and they move towards patient engagement, you still see a space that's filled with professional jargon, that it's not really addressing the need of the patient, but it just describes these are the steps in a very matter-of-fact way without actually providing any background as to why we have these steps and why is it the way we have. So in this sense, we put a lot of emphasis on the education of the patients, the education of the general public as to what is possible, because what we find is that still most of the questions that we get asked are the very basic questions that you would like to know whether something is good or bad, and is it good for the long term, is it bad for the long term? And the moment you start explaining that this is a very easy question, but a very complex answer, and it has to be broken in parts, at that point, then you start having some engagement and people wanting to know a lot more about what do you mean and why do you speak like this and how can we actually make it better.
Mm-hmm. Is there also, since you have more an international perspective, also very differences in countries when it comes to all these questions?
Yeah, absolutely. So we see a lot of collectivist, we see a lot more communal approach, let's say, in Southeast Asia, Southeast Asia. But this is to be anticipated because it's a very collectivist society. So you still have perhaps the village elders coming to the local healthcare center that would like to ask on behalf of the community, or they would like to understand first and then allow everybody else to engage. So we do see that, as opposed to the high income Europe, where it's more at an individual basis, one-to-one quality time that we're pursuing.
Mm-hmm. So adapting to the situation, if it's more like community based, individually based, so and also
yes, and there isn't a single recipe that's correct for everybody. It's very context driven.
Mm-hmm, mm-hmm. Yeah, thank you very much. It really also speaks my background is social science, so it's about communication and making
Yes.
things also understandable, and also what you already mentioned. It's also when you become a patient, that's also a role you need to kind of learn somehow, and also learn how to move in a system, in a new situation. And I guess this is also what you meant by this is, I guess, also the valuable knowledge also for the researchers, right? Um, so if our audience out there, our biobanking community says now, yes, I'm planning to do this for a very long time, but since, as Stephanie mentioned, my background is also in science and we don't learn this, and now we should communicate and do this complex, situated, context-dependent activities. So what would you recommend to someone just starting like patient engagement, let's say in their projects? I don't know who wants to start.
Oh,
Margareta.
well, yeah, being a patient, I would start when you walk into an absolutely blank room and you need to learn how to move in that room. And then you will have to have somebody who can advise you in the way, because otherwise you can't learn anything. So I think that if you go into the doctor's clinic, we see, for example, contact nurses as our angels, and they would be the first start, I think, of being interested in knowing more about yourself and what do I have and how can I live my daily life with this disease. So this is a first step into the movement of becoming interested in patient advocacy. And then you would need to have people around you who understand you. If they don't understand you at all, you will never become a patient advocate. You will walk out and you'll be frustrated and angry. But if you have this understanding or empathy or, well, somebody interested in you, then you will work reciprocally, I think. So you could actually learn, and you can actually teach even the professionals that this is the way I work and this is my life. And you can actually, if somebody asks me what matters to you, what is important for you, then you can actually reply, and you can have a good understanding, and you become more interested in what you want to do with your life and with your body and with the surrounding people and your family. And the rest comes. But if you're interested, you will need to learn more and more and more. And if you would like to go into the research and become a patient partner, you will have to learn more. And your article is excellent, Stephanie, because that really explains the levels. And I think that somebody in Sweden has read your article, because the authorities now are proposing these levels also. And they explain beautifully, I think, what you do in different stages.
If I just add to that, yeah, thank you, Margarete, so much for this. Yeah, and those levels are they are already science-based, or based on lots and lots of literature, and also lots and lots of experiences from other sciences. So from social sciences, we do have patient or group participation, whatever group it is, participation since decades, even in the social sciences and even in other sciences. So, and this is also something that I would recommend to scientists, being it basic wet lab researchers or other scientists, to have a look in literature and see what they can find to educate themselves on the different levels, and to look up and read about different examples, because there are lots and lots out there. And then for their very own research, and to get patient representatives in their own groups or in their own project, I would recommend that they do really a basic internet research about the patient association of their field, and then to contact them. And I think this is very important, to build up relationships with patient associations. So normally there are different patient associations. There are even patient umbrella organizations. So it's really it's worth it to search for them, and to make up an appointment, and to just share with them, okay, I'm curious, I'm planning my research, so let's just start and talk from the very beginning about different research questions and see whether we can develop a project together. So, but often I think the reality is that a funding organization, a ministry or whoever, or the EU Commission says, okay, now we have the checkpoint, patient participation, go. And then you have to run. And then you have to do this in a little bit in a short term. And we know this, we as patient organizations get lots and lots of questions to write letter of intents, letter of supports, and be a project partner. And we write project proposals together with other scientists. So this is a thing that we do. But I would really recommend every scientist who wants to do patient participation to start and reaching out to patient organizations before they have a concrete project in mind, just to build up a relationship. Because, as I said, we get lots and lots of questions for this. And of course, we have also to prioritize which, with which scientists we can work with, we will work with, and when we do have a relationship, of course, those people get prioritized. Yeah, so this is very important. And then, as Margarete said, so from patient to patient advocate, it takes a long time. It's a process, and we are all learning all the time. Also, we three might be in the game for several years already, but we're still learning, and lots of people need to learn. And also, scientists have to be trained in patient engagement. And there is, I know that for Germany, there is now more and more, there are like different trainings from different institutes or academies that provide training for different sciences, for different scientists in patient participation and how to do this and implement this in their very own project. So yeah, those 3 approaches, I would say, like research on what's already there on the literature, contact your patient organization in the field, and do some training.
That's good. Can I just add something there? That I've been into a research group where we checked on what is good and bad, what is successful in co-creation, and we actually looked upon 8,000 English-speaking articles and 4 Swedish, and we put together a report on recommendations how you actually can go about. And we have had training for both patients and researchers and professionals also, and funding organizations and politicians and everybody, you know, and it takes such a long time, but it's very slowly moving. And yeah, I will reach there, but it takes time, as you say. I will send you the report. I will give you a link to the report. Yeah.
But also, I mean, I have to say, from a researcher perspective, very few are trained into patient engagement. Very few are even aware about patient engagement until they actually get the funding, or they have to write the funding proposal for the EU, and then they fill in something just to fill in the box. And but they've never been exposed to it. So except for certain well-versed educational institutions, most of them actually are not considering patient engagement. I think that's something we need to change very early on in the education, at least in medical research schools, that the patient is part of the process. They're not somebody just outside who's being subjected to whatever we find in the lab.
And what I also hear from you, and I also can, of course, confirm as a social scientist, there are many methods out there. Yeah, social science has this repertoire on methodologies, but in that sense, there is no right or wrong, right? We also learn while we go, okay, this method worked good or bad in this or that situation.
Absolutely.
So it's always a process, right?
Yeah. Absolutely. And it's also, just to add to this, that we learn all the time. It's extremely important to publish about the patient participation or the whoever group participation. So this really adds to our general knowledge and gives us really good ideas and things to prevent and so on. So this is the it's and there are also instruments for this. So there is, for instance, the GRIP2 table, and there are some things you can use also to find in the literature how to report on patient engagement, so that you really write down what method you used, how you contact the patient organizations, what instruments you used, and so on. So, but it's really important and necessary for all of us to learn from each other. So, yeah, also publications in this directions are extremely important. And then to add, also is not just to publish in scientific literature, but also in the grey literature. So on websites of patient organizations, in leaflets, in newsletters from patient organizations, magazines, maybe some press statements from the ministry or so on. So this is extremely important to also publish in a language or in a way that everybody or most of the people can understand what was done and what came out of it.
So making it visible that it's already done, so no one has to kind of reinvent the wheel
Absolutely.
From every a project. So the visibility of the often, I would say, invisible work of working with patients and the benefits, I guess, you have also for research, right?
Yeah, absolutely.
Since we already mentioned Well, the funders. So some of them want you to involve patients, but well, often, as we know, all the reality. Okay, it's good to have funders want them, but okay, it comes with resources. You need time to do that. You need money to do that.
Yeah.
To plan it, to organize it, to produce leaflets, and so on and so forth. What would you think would find us more open to support this work?
Margareta, in Sweden, the largest funders, they request patient representatives in all their applications. And a couple of years ago, the patient representative was somebody they met on the street, somebody who was around, and not necessarily a secondary engagement patient, somebody in the local society or in the clinic. But it has changed. And I think the patient organizations have changed also. So if you're asked to be included, you will request some kind of compensation for your time and for your devotion into the research, and that you would like to be included in the design and in the study when you design the study protocol, and be included all the way until publication. And that is changed a lot in Sweden since they started requesting that. And the Cancer Society in Sweden, they hand out 800 million Swedish crowns a year in research. And we are offered to sit and judge the applications. And a couple of years ago, they said, well, you have to look if they have patient perspectives, and it should be person-centered also in the research. So we are now really tough. So if there's nothing on person-centered care, we said, we don't look at it. And I think that has also started changing the way research is done.
It's pretty the same in Germany, actually, that in the recent years, that patient engagement is a criteria to get funding from different ministries, but also from large other funding organizations, like the German Cancer Aid, for instance. And what we also do as patient representatives, being in the funding committees, and to evaluate the proposals. And what I think from the funding agency, what's important for them or why they are doing it is because what we can see, I think, or what's the aim of patient engagement is one of the several aims. So there are loads of it. Is to make the research more relevant to the addressed group, so to certain patients. And it's also to make it more relevant and then to make it more feasible. So to get a better participation rate in terms of participation, so take part in the study, being a study participant, to have fewer break or dropout rates and so on, to have in the end, to have a better implementation into patient care, from patient research to patient care, then have a better therapy adherence and compliance. So those are the biggest, what I know from our ministries, what are the reasons behind patient engagement, and that they push it. And then, of course, another big, not just theoretical, but also theoretical criteria or an outcome of patient engagement is, of course, that it's good for democracy. So you have these, people are engaged, people take part in shaping science. And this is, this is a really also an important factor, I think, at least for Germany, in our initiatives for patient engagement. To really engage people and have them being a part of science.
And just to make a small note, Malin, because a lot of the engagement we're talking about at the moment is interpersonal engagement. We have to look into the digital side of things because the younger generation is probably going to be a lot more digitally literate and more keen to engage through a non-interpersonal, or let's say digital environment into this process, which is actually quite fascinating. And one of the reasons why we keep coming back to this, that we have to work at it and we keep learning all the time because conditions do change, technologies do change.
So in terms of, sorry, Margarita.
Sorry.
Yeah.
We talk about funding, and I have to talk about the actually reimbursement for patients, because that is not moving in Sweden, and it's very difficult to get hold of persons if they work and if they have to take some days off to go to the government or something. They can't do that. So we are all there, we're white hair, and we can do it because we don't work anymore. But for other people, it's very, very difficult. And they say they're going to put an infrastructure in Sweden onto how you should handle this, because today it's not equal and not everybody can do it, and there is no reimbursement. So we really we request reimbursement for using our time as other people are. They are on their job sitting on the other side of the table, and we come and sneak in and we don't feel equal, I would say. So this is what we're really requesting nowadays.
Yeah, that's a very relevant factor also in Germany, to have funding for patient participation. It's just as you said, I mean, everybody can be a patient, and patient affects all people from all kind of ages and from all kind of different backgrounds. And typically, to get a certain representation of our experiential knowledge, we have to include different people. So, and those different people, for instance, of course, we do have to have reimbursement, but we also need, for people who work, we need a certain, I don't know what's called, I mean, so that you can be freed from work for a certain time and take this activity, and to have your employer being reimbursed for the time you're missing at work. So it's also a factor of time that we're having here. And we need young people, we need people who, I mean, all kinds of people, but they have to be able to participate. And what we often, or what we say in Germany, is that to volunteer, you have to be you have to be rich enough to volunteer, because if you're not, you have to take this time to earn some money. And so to get the representation, we need to include all the people.
Yes. And we're not there yet.
No,
far from.
But I don't know how it's going on in other countries, but in Germany, at least for the projects with patient participation, we get funding for the patient organization. So we get so there are different types of funding that we can apply for. So it's either be like your job, really, like 50% job fulfillment, or you get some funding per hour, or so there are different types, but at least for the projects we can apply for funding now too. But what we do have, just as the scientists, the same is the process of writing the proposal. So just as everybody, nobody gets any funding for this. And this is why we also want the funders, so the ministry or the other big funding agencies like NGOs, we want them to also change the funding policies to maybe having at least a two-step process, so that in the first step you give in a little proposal, just a short proposal, like 2 or 3 pages, which doesn't need a lot of time and so on, and then you get some evaluation, and then to write the big proposal, everybody already gets a little bit funding already. So this would be good for the scientists, but also for the patient representatives, because just as the scientists, as I said, we don't get any funding, any money for this at all. And this is difficult for all of us.
Yes, that is very difficult. And we actually managed with one national platform study. It's the first one in Sweden. So we had the training for the researcher, with the researchers. We had the training for the patients sitting in the patient board. And finally, we thought, now they understand each other. Now we can, go get going. And we didn't find funding for the work. But finally, they were employed by the university in economics. They actually funded the patients during the time to take, the study protocol. But that is the only one I've heard of, and but we will not give up, because we need to have that funding. We really need.
Absolutely, yeah.
But that is a general occurrence. So most of the countries that we work with across the world, in the same situation. So they want the patient organizations at the minimum to be engaged, but there is very little funding or even a methodology as to how do you estimate the funding that would be required to incorporate into the application proposals.
So still we have a long way to go.
Yes, absolutely.
Yeah, but this is also then a recommendation for the scientists then when they want to include patient representatives, to write the proposal together, even if it's hard for anybody, for everybody. And I know patient representatives are a new stakeholder, they are a new collaboration group, so you need more time for talking, you need more explanations and so on. But writing the proposal together is really a good thing to have the chance for funding for the patient representatives. Yeah. And at least in Germany, also writing the proposal together adds really to your chance to be funded in general. So it's an important issue now.
And also a chance to have successful research if you sit around the same table from the very beginning.
Absolutely.
Okay. Anything else? Cisis, do you want to add something else, or should we?
No, just very briefly to point about the social research, and I have to say that a lot of biomedical research is sitting very far away from social research and those methodologies that are employed. So it made a huge impression to me when I started collaborating with one of the local centers here in France that had a social research unit embedded within the hospital organization. And that was one of the reasons why the results and the research is actually so robust. It's made a huge difference, but it was very interesting to see how long it's taken for that unit to be accepted, for these discussions to start happening until they generate those results.
Yeah. I think that's really an important remark, that this participatory research is really very interdisciplinary. So with the patient representatives, but also with different sciences. And I also already experienced how valuable it is to be in a scientific participatory research project together, and then having scientists or people from other backgrounds with experience in participatory research to come in and, as you said, bring in the methods, but also the attitude, and train all the people. So because this knowledge, if you don't have any training before, how should you know? You can try, and I think trying is better than not trying, absolutely. But it really helps to have people within the project who are already experienced with it.
Yes. And it's interesting how the medical research differs with social science and or other research. So really, and I know that in cancer, it's even more complicated than if you are in cardiology or in other diseases. So cancer is more special, I would say, many times, in many ways, good and bad. Both.
Can you give us an example how cancer is, or what?
I think that, for example, cancer research in rehabilitation for cancer people, cancer persons, is much more difficult to get through. And in Sweden, they couldn't do a quality register for rehabilitation for patients because it's subjective. So we cannot do it. But you can do it with heart diseases, you can do it with other diseases, but it has taken many years. And until EU pushed and open up for quality of life, then we had to change, and they had to start listening to the patient about the experiences they have had or we have had. But it's taken a very long time. And maybe it was because we just died before, 50 years ago. And now it's slowly changing. And we are surviving, and it's a big problem because, I mean, we do survive. And we have a lot of complications after all these treatments we've had. And before it was not, we should be happy because we survived. But you didn't really think about the way and the methods you did to survive and to live a everyday life, maybe for 20 or 30 or 40 years after the treatment.
Yeah, absolutely. Yeah. So we see lots of long-term side effects and also long-term comorbidities. So this is makes it really special. Yeah. Also, when you think when young people are affected, it affects their family planning. So it affects so many aspects of their life. I mean, it's not that other illnesses don't do that, but still, cancer is it's still life-changing. It's really life-changing, I would say. Yeah.
And I don't think that the cancer researchers actually, or cancer care professionals, that they 30 or 40 years ago thought about survivorship. And now they have to include the survivorship. And then they have to start to listen to those who didn't die. And those who are still alive and have all these complications and late effects. So it's a large group.
So I guess it clearly underlines, the importance of engagement to have all these this long term. The people are affected really long term also.
Yes.
In the scope. I have to look at the time. It's a really great discussion. Thank you for the moment. But before we moving on to the question and stopping the recording, I would also remind the audience that we regularly share updates and on all these topics, and you can find it, for instance, in our newsletter, and where you can find on our website bbmorieric.eu on the ELSI knowledge base and website. And if you enjoyed this recording, I'm sure it's very helpful for many people. Do share it with interested friends. We will share the recording of the webinar and also as a podcast also later, and also don't miss our next episode. And thanks for attending.